Hello, I am Dr. Major Pankaj Surange. I am the director of IPSC India. I am also the honorary secretary of Indian Society for the Study of Pain. I started using cooled RF since last 4 years. Before that, I was using conventional RF technique. There were some major indications where we stopped doing conventional RF, but in last 4 years when it came to India, cooled RF technology, since then I am using the cooled RF. We were using conventional radio frequency for most of the indications. What we found that especially in joints, we were having some difficulty in getting the results. The results were not that good with the conventional RF. So I had stopped using conventional RF for the joints. So currently in my practice, I'm using it for the joints, for the osteoarthritis of the knee, shoulder joints, and for the bacoplasty for the discogenic pain. We have seen a drastic increase in the incidence of the discogenic pain, and especially young patients, because of the long sitting hours and prolonged driving. We have been struggling with managing these patients with the discogenic pain, because if you see the MRI, it looks almost normal and they have just a minor abnormality on the MRI. So people never used to consider that as an abnormality, and we used to manage them conservative. The most important indication what I found with the cooled RF is the management of the discogenic pain. The biggest advantage what I found is a non-surgical technique. It's a very simple, easy to learn also, and it is quite effective. When we talk about the technology, what is most important for us is that whether this technology is required or not. So we definitely need a technology where we can manage patients who are suffering from the discogenic pain, especially the younger populations. We cannot let them undergo big surgeries, and this technology, the cooled RF technology, given us a room for treating such kind of patients. In my experience, patients who have failed conservative management for the discogenic pain, who are having annular tears, it is not bulging and compressing the nerve. So these are the right indication for the bacoplasty or the disc repair procedure. I have not seen any patient who has come back with a similar kind of pain or with the similar complaints. In last 3 to 4 years, I have not seen any patient returning with the same problem. So I can say that it's a long term. It's a long term for us, yes. Normally what we do is that once the procedure is done, we don't advise any exercise protocols to the patient. In these patients, after the procedure, it takes some time for its healing effect. When we are doing the disc repair, with the use of bacoplasty or the annuloplasty, it doesn't happen that it suddenly becomes very strong. It takes some time for the granulation tissue to form over there. So this takes around 3 to 4 weeks of time. So these initial 3 to 4 weeks is a crucial time. Patient may have a very good pain relief maybe next day also. Normally in my practice, what I advise to the patient, just take 1 or 2 days of rest, because there will be some stiffness. Usually I advise them to join their duties after 3rd day, and then they'll have to take all the precautions whatever they were taking before the procedure. Like they should not lift heavy weights, they should not bend forward, they should not sit for long time. Another thing, you must advise them that they should go for regular walks. You should not ask them to go for the rest. Rest is not required in these procedure. Rather, we want them to be more active after the procedure. I think I am the first one to buy this machine in India. Definitely I have seen a good difference in the functioning of the machine. More effective, I can say, more effective than the previous generator. The biggest advantage what I found in this is that we can do 4 lesioning at a time. Suppose if one of the lesion is not working properly or there is some problem in the one of the probe, in that case we can actually stop that probe without disturbing the other areas. So we can continue with the 3. Suppose if you are doing a bilateral radiofrequency or the facet arthropathy, if one is not functioning properly, we can stop that, but rest we can continue. So that is one of the biggest advantage. Second, yes, definitely the look wise is really good. The touch screening is there. That is also really good. The conventional RF that we have used since last more than 2 decades now, we have found it is really very effective, but in some areas we had some limitation with the conventional RF. Like when this genicular branch, we started using this technique with the conventional RF, but we had a lot of failures in the conventional RF. So actually my practice, I had stopped doing genicular RFA because of this limitation with the conventional RF. When cool RF came, we saw that it's a bigger lesion, because the biggest issue is with the genicular RF or the procedures in the joints is the location of the nerve. It is difficult to see those nerves. We cannot find out these nerves. So we had to go as per the fluoroscopic guidance. So that was the biggest disadvantage of the conventional RF, that we don't know exactly where is the nerve lying and whether we are sitting over the nerve or not. So that is one advantage which cool RF gave us, that we can cover a larger area. Similarly for the discogenic pain. So there is no point of doing conventional RF in the huge disc. It's a very big tissue. In that tissue, we know that conventional RF has only very limited lesion size. So it is not possible. And so we have the literatures also, they are suggesting that it's a negative recommendation. We should not do conventional RF inside the disc. When this cool RF came, we started doing this technology and we found excellent results with that. Normally I'm very choosy about selecting the procedure and in selecting the technology, but when we see personal experiment, I found this cool RF is much better in some areas as compared to the conventional RF.